Most men think losing their morning erection is just a normal part of getting older. But what if I told you that's not true? The truth is, the slow loss of your morning strength isn't because of age. It's caused by something much easier to fix. Right now, everything inside you needed for an erection is still working and ready. The issue isn't a lack of ability, it's a lack of connection. Your body has simply forgotten how to flip the right switches on. I'm Dr. Sarah, a men's health specialist with over 20 years of experience, and what I'm about to share comes from both cutting-edge research and real patient success stories. Subscribe now, because this information isn't something you'll typically hear in a doctor's visit. In the next few minutes, I will show you 3 specific spots on your body that, when touched correctly, can naturally restore blood flow and bring back that morning strength. The evidence behind this simple, natural approach is truly remarkable. And it all begins with understanding that your body isn't broken, it's just been waiting for the right signal. The 3 spots I'm about to share with you aren't random locations, they're strategic connection points where your body's natural circulation and nerve pathways can be gently reactivated. Think of them as circuit breakers that have simply switched off over time, waiting for the right gentle pressure to flip them back on. In my 20 years working with men facing this challenge, I've discovered that the solution isn't about forcing your body to work differently, it's about reminding it how to work the way it was designed to. Your circulation system, your nerve pathways, everything needed for strong morning function is still there. We just need to help these systems talk to each other again. Let me share Robert's story, because it perfectly illustrates what's possible. Robert is 68, a retired electrician from Ohio, married to Helen for 42 years. When he came to see me, he was already working closely with his doctor for overall health management. What Robert wanted was to feel like himself again in the mornings, that sense of vitality and strength he remembered. I coordinated with his medical team, and together we incorporated these 3 activation points into his daily routine. Within 3 weeks, Robert noticed significant improvement in his morning strength. His doctor was pleased with his overall circulation improvements. Today, Robert continues both his medical care and these natural techniques, feeling confident and vital again. The beautiful thing about this approach is how it works with your body's existing wisdom rather than against it. Your circulatory system operates like a well-maintained plumbing network. When all the pathways are clear and the pressure is balanced, everything flows exactly as it should. As we age, certain key junctions in this network can become less responsive, which is completely normal. These 3 zones help restore that responsiveness naturally. Research from respected medical institutions supports this approach. Studies with men over 60 show that targeted pressure point activation combined with circulation-supporting habits can significantly improve blood flow patterns. In my practice, when patients use these techniques with their doctor's knowledge, they often tell me they feel stronger, more energetic, and more like themselves again. The science is encouraging, and the real-world results speak for themselves. Now, let me guide you through each of the 3 zones, starting with the most important one, Zone 1, the command center. This first spot sits just above your pubic bone, right at your body's energy center. This area contains a concentration of nerve pathways that send important signals throughout your pelvic region. When we gently activate this zone, we're essentially waking up the communication network that tells your body when and how to direct blood flow. Here's exactly how to work with this zone. Place your palm flat against this area, just above where your pubic hair begins. Apply gentle, steady pressure, not pushing hard, just firm enough that you feel the contact. Now, make slow circular motions, about the size of a silver dollar, for 30 seconds. While you do this, breathe deeply and slowly. This combination of pressure, movement, and conscious breathing helps activate the nerve pathways beneath. What you're doing is giving your nervous system a gentle reminder about this important area. Many men tell me they feel a subtle warmth or tingling sensation. That's your circulation responding. Some notice a sense of renewed energy in the region. Both responses are perfectly normal and indicate the technique is working. Zone 2, the flow regulator. The second zone is located at your perineum, the area between your scrotum and anus. Think of this spot as a flow regulator for both blood circulation and nervous system energy. When tension builds up here, which happens naturally with age and stress, It can restrict the smooth flow of both blood and nerve signals to your entire pelvic region. This zone requires a slightly different approach. Sit comfortably in a chair and place a rolled-up hand towel beneath you, positioned so it creates gentle upward pressure on this perineum area. You don't want intense pressure, just enough that you feel the support. Sit this way for 5 to 10 minutes while breathing normally. The sustained gentle pressure helps release tension in the deep pelvic muscles while encouraging blood flow through this crucial junction. Research shows that this type of sustained pressure point work can improve local circulation by helping tight muscles relax and allowing blood vessels to open more fully. What I find remarkable is how many patients notice improvements not just in morning strength, but in overall pelvic comfort and energy levels. I'd love to hear about your experience with natural approaches like this. Have you found techniques that work well alongside your medical care? Share your story in the comments. Your experience helps build our community of men supporting each other's wellness journey. Zone 3. The highway connection. The third zone runs along the inner thigh, from your groin area down about 6 inches toward your knee. This pathway contains the major arteries and nerve pathways that carry blood and signals to your entire pelvic region. I think of it as the highway system that needs to stay clear for proper circulation. Here's your technique for this zone. Using your palm and fingers, start at the top of your inner thigh and apply gentle pressure while slowly stroking downward along this pathway. Use steady, smooth strokes, spending about 10 seconds on each stroke. Repeat this motion 10 times on each leg. The pressure should be firm enough that you feel it, but never uncomfortable. This stroking motion helps encourage blood flow along these major pathways while also stimulating the nerve networks that run alongside the blood vessels. Think of it as clearing any small blockages and encouraging everything to flow more freely. Many men notice improved circulation not just in the pelvic area, but throughout their legs as well. Now that you understand these 3 activation zones, let me share 5 simple habits that will amplify their effectiveness tremendously. These aren't complex changes, they're gentle adjustments that support your body's natural circulation and energy systems. The morning breathing ritual starts each day with 5 minutes of deep, slow breathing. Here's the technique that research shows can boost nitric oxide production, a key molecule for healthy blood vessel function. Sit comfortably and breathe in slowly through your nose for a count of 4, hold for 4, then exhale through your mouth for a count of 6. This pattern naturally stimulates your body's production of nitric oxide, which helps blood vessels relax and open more fully. Studies from the American Heart Journal show that this type of breathing exercise, practiced daily, can improve circulation patterns and even help reduce blood pressure. In my experience working with patients and their doctors, this breathing pattern becomes a natural, energizing way to start the day while supporting overall cardiovascular health. The evening walk research indicates that gentle movement, especially after eating, encourages healthy blood flow throughout your system. A simple 10-minute walk after dinner can significantly support circulation. You're not trying to exercise intensely, just move gently to encourage blood flow and give your digestive and circulatory systems the movement they need to function optimally. Evidence shows that this timing, walking after meals, helps your body process nutrients more efficiently while maintaining healthy blood sugar levels, both of which support good circulation. What I find encouraging is how many of my patients tell me this evening walk becomes a pleasant routine they share with their spouse, adding both physical and emotional benefits to their day. The warm water method. Begin each day with a glass of warm water, ideally at room temperature or slightly warmer. This simple habit helps your blood maintain its optimal consistency for easy flow throughout your system. When you're even mildly dehydrated, your blood becomes slightly thicker, making circulation more challenging. This isn't about drinking massive amounts of water, just ensuring your body starts each day with adequate hydration to support smooth blood flow. Many men notice they feel more energetic and alert when they begin this habit, and that's because good hydration supports circulation to every part of your body, including your brain. The sugar awareness approach reducing added sugars in your diet supports the health of your blood vessel walls. High sugar intake over time can affect the delicate lining of your blood vessels, making healthy circulation more challenging. I'm not suggesting you eliminate all sweetness from your life, just becoming more aware of added sugars in processed foods and choosing natural alternatives when possible. Research consistently shows that maintaining stable blood sugar levels supports healthy blood vessel function. This doesn't require a complete diet overhaul. Small, sustainable changes like choosing fresh fruit over sugary snacks can make a meaningful difference in how your circulation system functions. What questions would you ask your doctor about adding these circulation-supporting habits to your routine? Comment below your questions. Help me create better content for our community of men taking charge of their wellness naturally. The mindful touch practice. This fifth habit might surprise you, but it's based on solid research about nervous system health. Gentle, intentional touch, whether self-massage, gentle stretching, or even petting a beloved pet, helps activate your parasympathetic nervous system. This is the part of your nervous system responsible for healing, recovery, and healthy function. When your nervous system is in this relaxed, receptive state, circulation improves naturally. Your body can focus on maintenance and restoration rather than stress response. Just 5 minutes of mindful, gentle touch each day can help shift your entire system toward better function. Creating your daily integration now. Let me give you a simple daily routine that combines everything we've discussed. This isn't complicated. It's designed to fit naturally into your existing schedule while maximizing the benefits for your circulation and nerve function. Morning routine, 7 minutes total. Start with your warm water, then move into your 5-minute breathing ritual. After breathing, spend 2 minutes activating the 3 zones we discussed, about 3,045 seconds on each zone. This gentle morning routine prepares your circulation system for the entire day ahead. Evening routine, 10 minutes. Take your gentle walk after dinner. Then, before bed, use the towel technique for zone 2 while doing some slow, deep breathing. This combination helps your body shift into its natural recovery mode for optimal overnight restoration. The timeline for noticing changes varies from person to person, and that's completely normal. Some men feel improvements in energy and morning strength within a few days, while others need 2 to 3 weeks of consistent practice. What matters most is gentle consistency rather than intensity. Your body is remembering how to function optimally. This process takes time and patience. Remember, we're working with your body's natural wisdom, not fighting against it. These techniques support the circulation and nerve function you already have. Research shows that when men combine these natural approaches with their regular medical care, they often experience the best overall results. I always encourage patients to mention these wellness approaches to their healthcare team. Most doctors appreciate when you take active interest in supporting your health naturally. Your doctor knows your specific health picture and can provide valuable guidance about how these techniques fit with your individual situation. Important considerations for your safety. While these techniques are gentle and natural, everyone's health situation is unique. If you have any heart conditions, circulation disorders, or take medications for blood pressure or heart function, definitely discuss these approaches with your doctor first. They can provide personalized guidance about what's most appropriate for your specific health needs. If you experience any unusual discomfort, dizziness, or pain while practicing these techniques, stop immediately and consult with your healthcare provider. These should always feel comfortable and natural, never forced or painful. What to expect on your journey. The most common early sign that these techniques are working is a general increase in energy and vitality. Many men notice they wake up feeling more refreshed, have better energy throughout the day, and feel more like their younger selves. The specific improvements in morning strength typically follow within a few weeks of consistent practice. Some men also notice improvements in overall circulation, warmer hands and feet, better energy levels, and just a general sense of everything working more smoothly. These are all positive signs that your circulation system is responding well to this gentle, natural support. The beautiful thing about this approach is that it works synergistically with good medical care. When your circulation is functioning well naturally, any medical treatments your doctor recommends can work more effectively. It's truly the best of both worlds, natural support combined with professional medical guidance. Your body has a remarkable ability to maintain and restore healthy function when given the right support. These 3 zones and 5 habits aren't forcing change, they're creating conditions where your body's natural healing and maintenance systems can work at their best. Whether you're just beginning to notice changes in your morning vitality, or you've been dealing with this challenge for years, remember that your body hasn't given up on you. With gentle, consistent support and good medical partnership, significant improvements are absolutely possible. If this evidence-based approach resonates with you, please subscribe for more practical wellness education that honors your relationship with your healthcare provider. Share this with someone who values both natural wellness and medical expertise together. We're building a community of men who refuse to accept that declining vitality is inevitable with age. Your morning strength, your energy, your sense of vitality, these aren't luxuries you have to live without as you age. They're natural functions that can be supported, maintained, and even restored with the right gentle, consistent approach. The research supports it. My clinical experience confirms it. And most importantly, men just like you are experiencing it every day.